Dr. Luke Evans.
Thank you, Mr. Deputy Speaker. Today is very much a bittersweet end to the year. Sweet nationally, as we've heard the news of another new vaccine coming online in the fight against the coronavirus, and also getting Brexit deal done. That's hugely important to my constituents who majority voted for Brexit, but also the chance to pull both Remain and Leave together to look forward to an outward future, hopefully for 2021. But bitter as locally, my constituency and indeed all the region in which I live is moving into tier 4. With that comes all the heartache, the anxiety, the stress, the morbidity and mortality that goes with increasing rates of COVID. And now I accept the decision. I think it is the right thing, given I've spoken and had contact with the hospitals that serve my area, the CCG in Leicestershire, but 30% of my patients go across towards the George Eliot. And both of the health organisations there have talked about the pressure on the NHS, not only in the numbers of COVID patients coming in, but also the pressure on non-COVID services, but also the impact it has on staffing and the absenteeism that is a real threat. And this combined together makes a real difficult issue. On top of that, we have our rates steadily increasing, although in my patch particularly, we're lower than the national average. And that all comes on top of the new strain that we've heard about in the last few weeks. And so the government, I believe, is right to take those decisions to change when the information changes. And that's why I'm pleased to welcome the dropping of the 14 days to 10 days of isolation, because as the science changes and we know more, we should therefore change our approach and do something different. And that leads me on to my ask for the government, and they are threefold. The first is I've welcomed the approach before of how the government has structured its focus, putting the NHS first, education, businesses, health and welfare, and the leisure activities, and then the hospitality industry. But as we've ratcheted back up in the new tiers, clearly we still have the fundamental problems of support for things like the travel industry, the pubs, the restaurants, the events industry, the wedding industries. These problems are not going away. Unfortunately, with the advent of a vaccine, there is a time-limited period. So I urge the government to consider putting further support in for these businesses to try and get them through. My second ask is around the vaccine rollout. And as I said, I really welcome the fact the Oxford vaccine has now come online and will be going live from the 4th with over 500,000 vaccines to go out in the first week. It's really good news to hear as well that the ministers are reassuring us it is the infrastructure that is there and it's simply the supply. As the supply becomes greater, so indeed will the delivery and getting the fight underway to fight this vaccine. But I'm concerned, and I'd like the government to address the thought about what happens when we get maybe 10% or indeed 20% of the population vaccinated. Because for me, there's a real issue here. Because as the public starts to see people become vaccinated, how they behave may well change, and in turn create a vicious spiral where we elongate the period under COVID and the need for further tiered restrictions because people feel that it's safe to go out. And a strong message must come from the government to make sure that people adhere to this and set an idea to us of what it is going to look like in terms of the saturation point for COVID. As the science changes, so should the advice. And finally, with my last minute, Mr. Speaker, I'd like to raise something that I raised in the summer. Given that the end is hopefully in sight, be it the spring or summer, and the end of the COVID debacle, I'd like to push again for a Department of Virus Legacy, a time-limited department to look at all the changes that have taken place during the COVID virus. After all, the COVID has hit every aspect of our working lives and indeed our social lives. Some for good, some for bad. It's really important to understand the lessons learned for the future, but also capitalise on the changes, for example, in my sphere of medicine, with telemedicine, better communications, a huge diagnostic network out there, a much improved vaccine programme now that will cover the entire nation. All of these things should be looked at and capitalise on to make sure we have something that will stand the test of time if we ever face another vaccine, another virus. Thank you, Mr. Speaker.